For many people, the scariest part of the surgery isn't actually the procedure, it's going under anesthesia. So what actually happens when you go to sleep? And how safe is it really?
Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon here in Beverly Hills. And I work side by side with board-certified anesthesiologists every day. And today, I'll walk you through exactly how modern anesthesia works, step by step, so you can feel completely confident before your upcoming surgery. So anesthesia is not just about putting you to sleep. It's about creating a controlled state where your body is comfortable, your muscles are relaxed, and your brain doesn't process pain or memory during surgery. The three primary goals are amnesia, you won't remember the procedure. Analgesia, you won't feel pain. Areflexia, your muscles stay relaxed for precision and safety. These effects are continuously monitored and adjusted in real time. In plastic and oculoplastic surgery, we use three main categories of anesthesia. The first being local anesthesia. Well, you're awake, the surgical site is numbed, hence the word local anesthesia. This is common for minor eyelid procedures or laser treatments, such as an upper lid blepharoplasty, which I do quite often in the office under local anesthesia. The second one is IV sedation, or twilight anesthesia. You're in a light sleep, breathing on your own. This particular anesthesia is done in the operating room, in contrast to local anesthesia, which is often done just in my very own office. IV sedation is ideal for most eyelid surgeries, particularly those that are restricted to maybe upper lid blepharoplasty, where the surgery is about an hour or so long, because essentially the surgery is relatively fast and the recovery is fast and side effects are minimal. The third type of anesthesia is general anesthesia. You're fully asleep with your airway supported. This is used for longer or combined surgeries, such as an endoscopic brow lift with an upper lid blepharoplasty and or a lower lid blepharoplasty. It's a perfect type of anesthesia for this sort of particular surgery. Each option is customized to the procedure at length, your health profile, and comfort level, and always with the help of a board-certified anesthesiologist by your side during the entire time. Before anesthesia even begins, we perform a thorough pre-operative assessment. This includes reviewing your medications, allergies, medical history, especially heart, lung, and thyroid function. If you take blood thinners, we'll have you stop them about a week before to help prevent bleeding. If you have high blood pressure, we want to make sure your blood pressure is controlled, and we'll often ask for some blood pressure readings for at least 3 or so days to get an idea where your blood pressure is, and if it's continuously elevated, we'll have you discuss that with your doctor before surgery so you're completely optimized. When it comes to the surgery, you'll be fasting for at least 8 hours before surgery. We generally recommend NPO after midnight. We'll go over all of that with you in order to help reduce any aspiration risk. In the operating room, the anesthesiologist places monitors for your oxygen level, heart rate, and blood pressure. A small IV line is started, and oxygen flows gently through a nasal cannula or mask. Once the IV medication starts, often with a drug called propofol, sometimes combined with other medications such as a relaxing medication as midazolam, you'll drift in a controlled reversible sleep with seconds. I generally try to avoid narcotics like fentanyl unless we really need to, because we try to keep our medications as minimized as possible so that you come out as recovery-wise as efficient and clean as possible, so you're up and at it in a much more efficient manner than traditional anesthetics, which combine a ton of medications which are administered all at once. And that's the beauty of modern anesthesia. So during surgery, the anesthesiologist continuously adjusts your medications to keep you in the ideal zone, deep enough that you feel and remember nothing, but light enough for a smooth, safe wake-up. Your vital signs, including blood pressure, oxygen, and carbon dioxide, are monitored every second. Modern anesthesia systems are remarkably precise. They can detect and correct small changes faster than human reflexes. Let's address some of the most common fears. What if I don't wake up? Well, in healthy patients, the risk of this serious complication is incredibly low with modern anesthesia, and less than 1 in several 100,000, lower than your chances of being struck by lightning. Can I wake up in the middle? Well, the depth of anesthesia monitors track your brain waves, making awareness under anesthesia extraordinarily rare, and it's important to reassure you about that. So will I feel groggy for days? With modern, short-acting agents like propofol, most patients are alert within 15 to 30 minutes and back to normal activity usually the next day. The truth is, anesthesia is safer now than it has ever been in the history of medicine. As the anesthetic wears off, your body naturally resumes control of its breathing and reflexes. You'll wake up gradually in the recovery suite with a nurse monitoring your oxygen and comfort. We'll give you small sips of water, check your vision and comfort level, and review your discharge instructions once you're fully awake. Some patients experience mild sore throat, nausea or chills, all temporary and easily managed. Most people go home within 1 hour after eyelid surgery. Every surgery I perform, from a simple blepharoplasty to a full bellow lift, is a team effort. My board-certified anesthesiologists are present, and we use hospital-grade monitoring systems in a fully accredited facility. Our goal isn't just to perform surgery, it's to make the entire experience seamless, calm, and safe. That's how we maintain both precision in surgery and a peace of mind for patients. If you've been anxious about anesthesia, know this. It's one of the most advanced and safest aspects of modern plastic surgery. And if you found this helpful, subscribe to this channel for weekly educational videos on eyelid surgery, facial rejuvenation, and recovery science. And if you're considering surgery and want to learn more, you can find additional recovery sources and my Skinua healing products linked below.